Childcare. Reasons why infant cries. Hungry. Wet. In pain. Uncomfortable. Child has temper tantrums. Divert attention to another activity. Safety precautions when toddler is in the crib. Remove big pillows. Remove sharp and pointed objects. Make sure side rails are up. Why toddlers explore their surroundings. To satisfy their curiosity. To develop their gross motor ability. How to enhance toddlers' physical growth and development. By playing, example, biking, basketball, running. What are the safety precautions of infant crawling? Don't leave baby in high places like cribs. Don't let baby climb the stairs alone. Toddler has convulsion due to high fever. Give tepid sponge bath, TSB. Put ice on armpit or pour baby with cold water and wrap immediately with a towel. Child is ready to be toilet trained. Baby can stand and sit alone. Baby says poo-poo and wee-wee. Baby goes in and out of the comfort room. You meet a bathroom/comfort room accident. If fire is too big, call fire department and ask for help. You should always be at the side of the client and comfort him. Activities that enhance the intellectual and creative needs of a child. Dancing, watching educational movies, singing nursery rhymes, reading books, give sketch pad for drawings and crayons. How to develop bonding with a child. Play with the child. Let the child help you with light household chores. Go to the malls with the permission of the parents. How to boost child self-esteem. Appreciate good things child has done. Give simple rewards. Precautions when serving hot soups/dishes. Let it cool first before serving. Inform child that the soup is hot. How to control a bleeding wound. Apply direct pressure. Elevate affected area. Cover with sterile dressing. Best outdoor activity for an 8 to 10-year-old child. Basketball, biking, playing ball games. Indoor activities that enhance gross motor development. Dancing. Jumping. Ballet. Hygienic practices that you should instill in a child. Hand washing. Toothbrushing. Taking a bath. Toilet training. Good grooming. Nail care. Importance of hand washing. To prevent spread of microorganism. Best place to bathe an infant. In the kitchen near the countersink. Why should you not leave infant or baby alone while bathing? To prevent drowning. How to prevent diaper rash. Change diaper from time to time. Use rash ointment. What is the importance in disposing soiled clothes and diapers properly? To prevent contamination. How long does it take to sterilize feeding bottles? -10 to 15 minutes after boiling point. Types of milk preparation. Breast milk. Powdered milk/milk formula. Ready-to-drink milk. What will you do with the leftover milk? Discard. When to burp the baby. Midway and after feeding. Ways to prevent colic. Burp the baby. During feeding, the nipple of the feeding bottle should always be filled with milk. How do you know if infant/toddler is choking? High-pitched cry. Struggling for air. What will you do if infant does not respond to the first aid procedure? Try another means of first aid. Call 911. Where do you use tympanic thermometer? Ears. What will you do if the child's heart rate is more than 120 beats per minute while at rest? Do nothing because it is still within normal range. What are the basic food groups? Philippine setting. Go. Energy-giving foods. Grow. Body-building foods. Glow regulates body processes. Canadian setting. Milk and dairy products. Meat/fish and alternatives. Bread and cereals. Group. Fruits and vegetables. Performing housekeeping activities. First thing to do before vacuuming a carpet. Remove first scattered small pieces/objects before vacuuming. How will you test if wall is washable? Try first on one corner and test a small portion behind the corner that can't be seen. How to control household pest. Always dispose garbage properly and regularly use insecticides or pesticides. Basic stitches used to mend torn seam. Running stitch, back stitch. How to remove catsup/tomato stains on fabric. Soak in cold water with soap. Use stain remover. Precaution before applying bleach to linens, clothes and fabrics. Read the label of the fabric. How to prevent shrinkage of a fabric when using a machine clothes dryer. Lower down the temperature of the machine dryer. Describe the color fast and non-color fast. Color fast fabric does not bleed. No color fast fabric bleeds. What will you do to have a smooth and easy ironing? Use fabric conditioner. Use steam iron. Basic step to maintain machine dryer. Always clean the lint filter. Proper steps in cleaning the ceiling, walls and floor. Ceiling, clean corners going to the center. Walls from up going down. Floor clean going towards the center. Commonly used home disinfecting agents and solutions. Alcohol, Domex, Clorox. Why is feather duster not recommended use for dusting? Because it does not absorb dust. Why do you need damp cloth to dust furniture and fixtures? It absorbs dust. Proper sequence of cleaning toilet bowl. Remove all materials on top of the toilet, pour disinfecting agent into the rim of the bowl, then wait for a few minutes before cleaning the bowl. 15 minutes approximately. Importance of waste/garbage segregation. To prevent contamination/prevent certain diseases. To maintain cleanliness and orderliness of the place. Difference between open, closed, and occupied bed. Occupied bed, top sheet is fan folded. Closed bed, top sheet is tucked. Occupied bed, patient remains on the bed. Why is there a need to sort linens and clothes before washing? To prevent linen from staining. 2 type of iron. Steam iron, regular iron. What is the purpose of rubber draw sheet? To avoid linen from staining. To prevent linen from spillage. Elderly care. Importance of back rub to bedridden client. Soothes the skin, promotes circulation, make client feel relaxed and comfortable. Considerations in assisting client with personal needs. Safety and privacy of the client. Maintain client self-esteem. Let him do things he can still do. Let him feel loved and important. Safety precaution when transferring client from bed to wheelchair. Always lock the wheelchair as well as the wheels of the bed. Physical changes related to aging. Appearance of white hair, loss of teeth, postural deformities, wrinkle skin. Basic role of a caregiver in the case of a client with Alzheimer's disease. Always remind the patient from time to time, orient him every now and then as to time, date and place. Most effective way to control spread of infection. Hand washing. Cancer patient says, "I wish I would die now." How will you respond? Life is beautiful, live life to the fullest. Do you want to talk about it? How will you react when being criticized by your colleagues at a workplace? Just ignore it, identify your weakness, and accept it, focus on your job. Recommended diet for elderly client. Low salt, low fat, low cholesterol, low carbohydrates. You found out that a client with Alzheimer's disease scattered stool in the room. What will you do? Clean the client first and clean the room. Orient him again to where the bathroom is. How will you determine the maximum inflation point when taking blood pressure? Ask patient previous blood pressure, then add 20 to 30 millimeters of mercury. Encourage client to urinate prior to bed bathing. Why is it necessary? To avoid delay in the procedure. Undress/dress client with right-sided paralysis. Undress from good side to bad side, dressing from bad side to good side. Safety precaution when caring for client with diminished vision. Well, lighted room, remove obstruction in the hallway, use rubber or non-skid shoes. Prevent fall or slip in the bathroom. Use non-skid mats, put handrails in the bathroom. How do you know if bottled content is poisonous? Read label. Protective device for infection control. Gloves, mask, gown, cap, goggles. Common signs: diabetic, has low blood sugar. Numbness, cold, clammy skin, dizziness, fainting, disorientation. Typical sign of impending heart attack. Chest pain. Dyspnea, chest guarding. First common sign of infection. Fever. Client has BP of 150/100 mmHg. What will you do? Have the client rest for a while, recheck BP after 30 minutes. If it remains the same, give prescribed medication. Importance of indwelling urinary catheter care. To prevent UTI. How often do you change client's bed position? Every 2 hours. What are the considerations in preparing meal for an elderly client? Medical conditions, food allergies. Why is there a need to apply the principles of body mechanics? To prevent back aches, prevent injury, maintain good body posture. What are the ABCs of CPR? A. Airway. B. Breathing. C. Circulation. Indications that you need to stop CPR. When resuscitator is exhausted, when the client is dead. When the scene is not safe, when the physician has assumed the responsibility.